In this week 16 e-learning, we will go through a scenario based. So let's take a look at the case study here. So we're going to study the 7 steps of a ethical decision-based making process. Now let's study the ethical dilemma. Madam Ma children is to bring her home for palliative care versus to let her stay in the ICU with ventilator support. So these are the ethical dilemma that we are facing. And we need to collect some data before we come out with solution and then evaluate the solution. So from the data, it shows that there are 103 consultations for palliative care and withdrawal in ICU, and 37 died within 72 hours after the palliative care withdrawal were analyzed. And the data also shows that only 3% of the patients survive after the ventilator, and 31% where family could not achieve a consensus failed to withdraw the ventilator. And lastly, palliative care is associated with significantly lower likelihood of ICU and also lower inpatient cost. So in other words, palliative care service can provide a better quality of life and therefore decrease the cost of care for terminal ill patients. So I would like to talk a little bit more about beneficence. Beneficence means to do good. So to keep the patient's minimal in ICU, intubation is one of the ways to prolong her life. So it will give hope to the children. Non-beneficent means to do no harm. So by intubating Madam, which means that it can prolong her life, but it may be making her uncomfortable. So letting the patients die naturally with palliative care, it can actually help to relieve the patients from pain and discomfort. And how about paternalism is if we had decided, the healthcare workers or professional decided that is to intubate Madam Ma, we have to inform the relative about the risk. And there will be a risk without, of course, ventilator if we decided to pull off the ventilator. And lastly, informed consent to apply, because whether we want to take out the ventilator, we need the family members to fully understand the conditions of Madam Ma so that the children will be able to understand what are the signs that will happen if we decided to remove the intubation, and that means she will not be able to breathe in by her own. So what are the possible solutions? So these are the possible solutions that we have. So now let's take a look. Explain to the children on the consequences of bringing Madam Ma home for palliative care, or if they decide to continue to stay in ICU with the ventilator support. So we let the children compare the two of the solution and let them decide. But we must give them information and also support on an ongoing basis. And if they decided to bring Madam Ma home, we will respect their decisions and we give them support by offering nursing help, and if they need to have a home nursing foundation nurse to visit them to assess and to help them, we will have to offer the help or to get an agency nurse to in the care of palliative, because they are not medically trained, so they will need a professional to be with them at all time. And in terms of the solution choices, we also educate the children on how to take care of the patients at home, and also provide counseling and emotional support for the children, so that it will help them to reduce anxiety, stress, and especially if they do not know how to cope if the mother's conditions deteriorated. As for the code of ethics, professional conduct, value statement 1 apply, because we helped and assist considering the Myanmar children's need and concern and stress level. So we will respect them and help them on the ongoing process, involving them in the decision making, planning for the palliative care. Now, value statement 2 apply in this scenario. Value statement 6 also apply in this scenario. And value statement 4 apply in this scenario as well, because we are helping to protect, to maintain the privacy and dignity of Myanmar by preserving her and her family privacy and dignity, uh, and also supporting in a peaceful death if they decided to bring her home. So the reflections for this is we study the data that palliative care for this scenario is the best, is to bring the patient home because she's already 88 years old, and family members can spend more time, quality time with her. And also it will be better that patients to be brought home and the continual care given by her children. And lastly, that Myanmar decisions could be she would like to pass on peacefully at home and not in a foreign place, example like in a hospital. So you have completed this e-lecture, and please do the QR code, post the QR code and do the questions, and the lecture, both the lecture and tutorial attendance will be taken after you complete the answer. And once again, please fill in your student name and your student ID. All the best. Thank you.